One drink, two drinks, three. When does social drinking become damaging drinking? If you've ever wondered whether your drinking habits could be harming your liver, the answer is probably an intuitive yes, and this video is for you. Today we're exploring alcohol-related liver disease, the warning signs you need to know, and the surprising differences between drinking guidelines around the world. Let's start with a sobering fact. Your liver processes 95% of the alcohol you consume, and it can only handle so much before permanent damage begins. Alcohol damages your liver in 3 distinct stages. And the scary part is that because progression is slow, you might not feel anything wrong until it's too late. First comes fatty liver, also called steatosis. Most people with fatty liver have absolutely no symptoms. You could be walking around right now with a fatty liver and have no idea. About 1/3 of people will have an enlarged liver that a doctor can feel, but it usually doesn't hurt. But then comes alcoholic hepatitis, and this is where things get serious. You'll start feeling sick with a fatigue that doesn't go away, fever, yellow skin and eyes from jaundices, and pain in your upper right abdomen where your liver sits. Your liver becomes swollen and tender. About 40% of people with alcoholic hepatitis get worse even after they stop drinking and end up in the hospital. Finally, cirrhosis develops. This is permanent scarring of the liver. If you're lucky, it stays compensated, meaning your liver still works well enough to keep you healthy. But when it progresses, you face life-threatening complications like internal bleeding from swollen veins in your esophagus, fluid buildup in your belly called ascites, and confusion from toxins building up in your brain. Now let's talk about how much is too much, because the answer might surprise you. Different countries have very different ideas about safe drinking limits. In the United States, the National Institute on Alcohol Abuse and Alcoholism defines risky drinking as more than 14 drinks per week for men or 7 for women. That breaks down to about 2 drinks per day for men and 1 for women. They also warn about binge drinking, which means 4 or more drinks for women or 5 or more for men within about 2 hours. But here's where it gets interesting. The new European guidelines, which take effect by the end of 2025, are much stricter. They recommend only 2 drinks per day for men and just 1 for women, with at least 1 to 2 alcohol-free days each week. They also emphasize drinking slowly and alternating alcoholic drinks with water. What exactly is a standard drink? In the US, it contains 14 grams of alcohol. That's 1 12-ounce beer at 5% alcohol, 1 5-ounce glass of wine, or 1.5 ounces of 80-proof spirits. The Europeans measure differently. They count 25 centiliters of beer, 10 centiliters of wine, or 2.5 centiliters of spirits as 1 drink. The bottom line, what Americans consider moderate drinking, Europeans now consider risky. And for anyone with existing liver disease, doctors recommend complete abstinence. There's no safe level. Here's something that might shock you. Women face much higher risk of liver damage from alcohol, even when they drink the same amount as men. It's not about body size, it's about biology. Women produce significantly less of an enzyme called alcohol dehydrogenase, especially in the stomach. This enzyme breaks down alcohol before it can reach your liver. Since women have virtually none of this enzyme in their stomach lining, more pure alcohol passes through unchanged and hits the liver directly. This means women may develop serious liver damage with only 20 to 30 grams of alcohol per day. That's roughly 1 to 2 drinks. Men typically need twice that amount before facing similar risks. It's not fair, but it's biology. How do you know if drinking has become a problem? Doctors use a simple but powerful screening tool called CAGE. It's just 4 questions, but they can reveal a lot. C stands for cut down. Have you ever felt you should cut down on your drinking? This question gets at whether you've had that nagging feeling that maybe you're drinking too much. A is for annoyed. Have people annoyed you by criticizing your drinking? This explores whether friends, family, or co-workers have expressed concern about your alcohol use. G means guilty. Have you ever felt bad or guilty about your drinking? This taps into your internal feelings about your drinking habits. E is eye-opener. Have you ever needed a morning drink to steady your nerves or get rid of a hangover? This is a red flag for physical dependence. If you answer yes to 2 or more of these questions, it suggests you may have an alcohol use disorder and should talk to your doctor. The CAGE questionnaire isn't perfect, but it's a good starting point for an honest conversation about drinking habits. When doctors suspect alcohol-related liver disease, they look for specific patterns in blood tests. The most telling sign is something called the AST to ALT ratio. AST stands for aspartate aminotransferase. ALT means alanine aminotransferase. ALT means alanine aminotransferase. Both are enzymes that leak out of damaged liver cells. In alcohol-related liver disease, the AST to ALT ratio becomes 2 to 1 or higher. Here's why this happens. Alcohol causes vitamin B6 deficiency, and ALT needs vitamin B6 to function properly. AST is less affected by this deficiency, so it stays relatively higher. Doctors also look for elevated gamma-glutamyl transpeptidase, or GGT. Alcohol directly stimulates this enzyme, so it can be high even before significant liver damage occurs. Think of GGT as an early warning system. Other blood changes include low albumin from poor nutrition or liver failure, and enlarged red blood cells from both alcohol's direct effects, and folate deficiency. Low platelet counts can result from alcohol's toxic effects on bone marrow, or an enlarged spleen from liver scarring. Here's the hard truth. The only proven treatment for alcohol-related liver disease is complete abstinence from alcohol. There's no medication that can reverse alcohol damage while you continue drinking. But here's the hope. If you stop drinking before cirrhosis develops, your liver has remarkable healing abilities. For people with severe alcoholic hepatitis, doctors may prescribe steroids like prednisolone for 4 weeks, but only if there's no infection or bleeding. Nutritional support is crucial because most people with advanced alcohol-related liver disease are malnourished. The good news is that help is available. Medications like naltrexone can reduce alcohol cravings. Support groups, counseling, and rehabilitation programs all improve success rates. The key is getting help early, before permanent scarring occurs. For those with end-stage liver disease, liver transplant becomes an option. Survival rates after transplant are excellent, comparable to people whose liver disease isn't alcohol-related. The old rule requiring 6 months of sobriety before transplant is evolving. Doctors now focus more on predicting who will stay sober after transplant. Your liver is remarkably resilient, but it has limits. The amount of alcohol that causes liver damage varies from person to person. But the warning signs are consistent. Pay attention to how much you're drinking, be honest about the cage questions, and don't ignore symptoms like fatigue, abdominal pain, or yellowing your skin. Remember, this information is for educational purposes only and doesn't replace professional medical advice. If you're concerned about your drinking or liver health, talk to your healthcare provider. They can perform proper tests and help you make the best decisions for your health. Take care of your liver, and it will take care of you, Thanks for watching, and remember, knowledge is the first step toward better health at Mini_Medicalsons. This summary is based on information from the Merck Manual for Healthcare Professionals.